And now, San Diego Connect.
I'm Heather Rowe. Throughout COVID-19, some services were delayed, but UC San Diego Health never stopped taking care of its patients with cancer. Safety protocols are in place to ensure the safety of everyone involved. Dr. Ann Wallace is joining us to explain. Great to have you here, doctor. So some of the services were canceled at the beginning of the stay-home orders, but the care teams at the Breast Health Center didn't stop seeing its cancer patients. So tell us about the safety protocols that have been put in place to keep your patients and your healthcare workers safe.
So the UCSD Breast Center adopted all of the same protocols that UCSD had immediately placed into action. And that was early masking of our staff and our patients, social distancing of the waiting rooms and of distancing apart visits. And then, of course, testing as soon as it became available. We tested our patients who were having procedures and infusions and all of our staff.
Yeah, because patients, that's the last thing that you want to have to worry about on top of everything else. So I know clinical trials are a really important part of treatment. So do your patients still have access to clinical trials during this time?
They do. We never stopped offering therapeutic clinical trials. And in fact, we got almost busier with them because we were seeing patients who had been denied elsewhere. So ours are extremely active and full force.
So what is the Breast Health Care Center specifically doing to provide continued support and care to patients during this really, really challenging time?
Well, breast cancer is really a little bit different of a cancer because it brings with it the social anxieties and the welfare of the women's homes, et cetera. And so the first thing that I heard from patients was that they were worried that their disease didn't count anymore, that it was being trumped by the pandemic. And so we put in all the social services with our social workers, with our case managers, our nurses, et cetera, to make them feel comfortable. We then, of course, ramped up all of the safety measures that they also needed. We never stopped operating. We tested them as soon as we could test them before procedures and infusion. And so we assured them that not only did we care about their disease still, but that we also cared about their safety. So it made them feel really warm and well cared for.
Because it's not just physical, it's emotional too. Doctor, thank you so much. For more information, call 1-800-926-8273.